Welcome to Integrity Linguistics Institute. So, what is the question asking us? Okay, so let's read the question, right? How did the young patient called David react to the amputation of his leg? So, here, what you need to do is you have to bring in the strategy called keyword analysis. Right? You have to identify what are the keywords and you have to analyze the keywords together. Now, see, here the first question is, how did the young patient called David? Okay, so how, first keyword over here. So this is a young patient called David, react to the amputation of his leg. Okay, so what is the, so these are the keywords over here, right? And now, once you know the keywords, especially, okay, so especially this, we are dealing with the questions now, not the answer options. There is something that we call as the question stem. Question stem is nothing but the focal point of the question. So what is the focal point of the question? Okay, because the focal point will help you to understand what your duty is. Okay, the stem of the question. So here the question is asking you how David reacted. This is the stem of the question, right? This is the focal point of the question. So what is your duty here? Your duty over here is to identify how David reacted when he found out that his leg got amputated. Right. So see, now in the audio, they will say the job of David. They will say the age of David. They will say how David met with the accident. They will say what happened to David. They will say like when his leg got amputated. They will say what medications they gave him. They will talk about the side effects of the medications. And also they will talk about the reaction of David. All these things very casually, very normally they will say. And you should have the ability to avoid distractors. Okay. As I told you, they will not only, so the fully they will not be talking about David's reaction. They'll be talking about so many other things as well. Right. So that useless information is what we call as distractors, that useless information. And you should be able to avoid those useless information. That is, your mind should tell you, I don't care what happened to David. I don't care what medications were given to him. I don't care which leg got amputated. I only want to know, I only care about the reaction that David had. That when he found out that his leg got amputated, how did he react? Now, see, reaction. What is that? That is a feeling. Okay. That is a little bit of a, it is a feeling. So that reaction is what you need to identify. Now, see, only when you are reading with quality. All right. So only when a student is doing quality reading, they will be able to think, they will be able to earn this clarity. Simply reading all these questions and answer options 2, 3, 4 times, they will never be able to get this clarity. So that is why I always tell you quality reading is what you have to always practice. Right. Now over here we have three answer options. So he felt he was now excluded from his normal life. Okay. So here also we have some keywords. He felt, so how did he feel that he was now excluded? Opposite of include. Include basically means taken, exclude basically means to kick out. So he felt that he was kicked out from normal life. See, everyone is walking with two legs. He alone is having only one leg. So when he found out that his leg got amputated, he reacted as if he was now kicked out of society. That is, he felt excluded from his society. So that is the reaction over here. Answer option B, he compared it to the experience of a relative dying. So when he found out that his leg got amputated, okay, he actually compared it to the experience of a relative dying. So see, when a close relative of us passes away, we will feel extreme sadness. We will feel extreme sorrow because they are never coming back. They have gone. Okay, they are never coming back. Okay, so when he found out that his leg got amputated, he reacted in this manner. So he compared his amputation to the experience of a real relative dying. Okay, so he felt as if a close relative has gone away. So that is the reaction over here. What is the answer option C telling us? He resented his inability to take part in physical activities. Okay, so jogging, swimming, running, walking. Okay, these are all physical activities which require two legs, and he was no longer unable to do. So he understood that he was no longer able to do because one leg has been amputated. So he's having an inability over here. Now, before I give you the full explanation, what is this word over here? Resented. Type your answer in the chat box. What is the meaning of resent? We have recent. Recent basically means what? Recently. It is talking about a timeline, very recently. But what is the meaning of resent? What is the meaning of resent? This is an advanced vocabulary. If you want, you can type your answer in the chat box. I'll give you 5 seconds time. Resentment. Okay, so no one knows, right? So resentment or resent basically means a strong dislike. Okay, so for example, I resent eating green vegetables. Okay, I only like ice cream. I only like eating cake. I resent eating vegetables. Actually, I really like vegetables. I'm just selling. Okay, there are some students who like some children who don't like eating vegetables, right? So I can say he resents. He resents waking up early in the morning. He resents eating healthy food, which means there is a very, very strong dislike. Okay, and we can say, like, if you don't like a person, I resent that person, means you have a very strong dislike to that person. That is what we call as resent or resentment. Now you see how the OET is very cunning. Okay, so this is how most of the questions are. So you should be extremely careful when you're reading these questions. Right. So here he resented. So when he found out that he is no longer able to, like he has only one leg, he developed a very strong dislike. Okay. He was very, very angry because he is now not able to take part in any physical activities. Right. So this is how you have to do quality reading. That is, you have to like use the 90 seconds over here. Now, so I basically explained so much over here. So this question should be easy for you. So remember when I told you, you have to ask yourself the right questions. Okay, you have to ask yourself the right questions. So here, this is the question that I'm asking you. What kind of question is this? So when you read this question, how did the young patient called David react to the amputation of his leg? Okay, I have one question over here. So I'm asking you, what type of question is this and what should you listen for? So see, the audio is yet to come. The audio is not yet playing. Okay, the audio is about to come. But when you're listening to the audio, what should you listen for and what type of question is this? So is it answer option A, B, C, or D? So should you listen for medical treatment options? Should you listen for emotional reaction or personal experience? Should you listen for the expert opinion or should you listen for physical symptoms? What are you supposed to listen to? Is it A, B, C, or D for this question? Type your answer in the chat box. Quickly, quickly. Yes, very good, right? It is answer option B. Yes, very good, right? You have to listen for answer option B. Patient's emotional reaction, right? So here it is an emotion over here. Reaction is always an emotion. So you don't, so they will talk about treatment options. They will talk about, the surgeon's opinion. They will talk about symptoms. Nothing of that matters. Only the emotional reaction of the personal experience. So when the audio is going to play, okay, you should tell yourself, this is what I'm looking for. And when you're listening to the audio, your entire attention, your entire focus should only be there. Right. So here the correct answer option is B, patient's emotional reaction or personal experience. Right. So what type of question this is? This is a patient's emotional reaction or personal experience type question. Now see, this is the thing that you have to listen for. Right. Now, let's see how you can mentally prepare for this particular question. Like how you can mentally prepare. So here you have to listen how David felt about losing his leg. So what is the strategy over here? How should you prepare your mind? You have to focus on emotional words. Okay, you have to focus on words that expresses emotions. So look very attentively for words such as pain. See, pain is an emotion, shock, grief, okay, or comparisons to other emotional events. Or else what they will do, he will compare it to other emotional events. Okay, and don't get distracted. So don't get distracted for general facts. Stay alert for David's personal story. Right. So this is how you prepare. Now you see, now you have so much clarity. Now see, even before the audio plays, you know, okay, this is the type of question. This is what I'm supposed to listen to. And when the audio is going to play, your entire attention, your entire focus is going to be on the right part of the audio, and it will be easy for you to find the correct answer.